Hi, I'm Dr. Tim Schurman. I'm a plastic surgeon. My decision to become a physician was really not a conscious thing. It just was something that I always felt that I should do. It allowed me to put together the two things I like the most, the sciences and working with people together, and it's worked out well. It's given me an opportunity to put two very important parts of my life together. I chose plastic surgery basically because it sort of chose me. I liked so many different things about surgery. I enjoyed ENT, urology, obstetrics, all those type of things, and even general surgery. And plastic surgery allowed me to kind of put all those things together. It's a quite varied field. A lot of different things make it up. As a matter of fact, I do not only plastic surgery, but hand and upper extremity surgery. One of the things I like about my practice is that it's really sort of a three-legged stool. I have my hand and upper extremity practice, which is one of my favorite parts of what I do. I did an extra year of training after I finished my plastic surgery fellowship. In addition, I do a fair amount of breast and body contouring surgery and also general reconstruction for patients who've had problems either from cancer, trauma, or other medical problems. You know, one of the things I enjoy about the Iowa Clinic is that there's such a wide range of physicians here. When I was first in practice, I was in a single specialty group, and basically we could talk about plastic surgery. Here you have all the different disciplines, whether it's in vascular surgery or cardiac surgery, ENT, the medical subspecialties, and so there's always someone around to go over something with you if you need something. And that's really nice to have sort of that in-house consultation available. For example, with my hand patients, if there's a question about an X-ray or an MRI, I just walk down the hall. And I can sit down with a radiologist and go over things and really get a good feeling for what's going on with the patient. I guess the one word I would use to describe myself is complicated. And I don't mean that in a bad way. I think that there's a lot of aspects to my personality and what I do that really translates well into plastic surgery. Plastic surgery is a wide discipline. There's a lot of different things going on in it, and there's a lot of balls up in the air, if you will, because there's just so many different things that we do. And I think you have to be able to look at things in a different way each time. And because of that, I think it's important to be, well-rounded, have a lot of facets to your personality, and a lot of facets to what you do professionally. And I think plastic surgery requires that of a physician to do it well. If I wasn't a physician, I would probably be a teacher. And I think part of that stems from the fact that a lot of what we do as physicians is we teach. Whether we're teaching our patients about what we're doing for them and how it's going to help, or the people around them, family and others, about what we've done for their loved one. And I think that really is part of what we do. We're lucky here in the clinic that we work with at Iowa Methodist, and we work with residents, so it gives us an ability to teach there also. And that's really very gratifying. I like to work out. I like to read. I spend a lot of time these days looking at reading things on philosophy, psychology, and spirituality. Now that my kids are in college, I have time to actually do things, and so I get a chance to look at the things that I didn't do in those years. Actually, my favorite iPhone app is one on the weather, because I like to play a lot of golf, so I want to see what's going to be going on in the afternoon if I'm going to be able to get out and play. I also play a lot of solitaire, and so that's probably my second favorite app. 3 unique things that you'd find in my refrigerator. I guess, I don't know if it's unique. I have anchovies. My father-in-law gave me a taste for those, and Caesar salads, and different kinds of olives. I like a good antipasta, and olives are always an important part of that. Also different types of artisanal sausages like chorizo and other things. Probably the fact that I do yoga, and I do it quite a bit. I mean, most people don't think of guys doing yoga. I started doing that with my wife several years ago, and I find that it helps a lot. Keeps me more flexible, helps my golf game, honestly. But that's probably one of the most surprising things. I mean, if you go to a yoga class, there's probably 2 guys there, and I'm usually one of them. I've been with the clinic now for about 15 years, and the clinic has allowed me to expand and develop my practice better than I could have done on my own. And I think a lot of that's because of the colleagues that I have around me, not only the guys on my own department, Dr. Yen, Reese, and Lekis, but also the other physicians and the other specialties. And I think that's been a very special part of my practice here.